My name is Matthew Jacques, and I'm here with On the Road of Recovery to talk about MAT, medication-assisted treatment. I am a patient as well as a provider in medication-assisted treatment. My story starts a lot like many others. 2007, I got very sick, and that's the height of the opiate era, where they treated pain as a fifth symptom, and I was a product of that, given upwards of 240 milligrams of Oxycontin a day, fentanyl suckers, which they don't even make anymore, Percocets, the typical story, pain management, doctors never really educating us on, the addiction phase of pain management and how addicting these medications are. Obviously strongly effective, or highly effective, but in the end didn't turn out very well. I was introduced to medication-assisted treatment after going to the emergency room. I had stopped into the emergency room because I had thrown away all of my opiates. I decided after 2 years of being heavily sedated that I just didn't want to be sedated anymore. I had a newborn baby girl. She was about 1.5 years old. And I decided I just didn't want my head to be cloudy anymore. So I decided to throw away all of my opiates. Well, lo and behold, I was introduced to not precipitated withdrawal, but withdrawal. Went to the emergency room, thought that I was sick again. The doctor told me, no, you're not sick, you're in withdrawal. Kind of had some choice words for him, because I was not, he called me an addict. He said, you're addicted to these pills. Argued with him for a little bit and said, I took them as prescribed, I took them orally, I never abused them at that point. I did what they told me to do. And that's the thing, from the minute we're born, we're trained to trust our doctors, our pediatricians, from childhood. Parents trust them, everybody trusts doctors. So why wouldn't I trust that what they were giving me were, okay? I remember crying and asking them, what do I do now? I'm married, I have a baby girl, and I have this addiction. What do I do? And he said, you got to go to detox. So I did. I went, checked into Talbot Hall. I remember my first day at Talbot Hall, and I'll never forget it. I was 48 hours with no opiates. Sick is an understatement. It's often hard to describe what opiate withdrawal is to patients and parents and the population. It's just something you'll never understand unless you've ever gone through it. You just simply can't. The flu times 100, I've heard, you just can't understand it. Your entire body is in agony. They say you can't actually die from withdrawal other than alcohol and benzos, but I can tell you when you're opiate withdrawing, you definitely feel like you're going to die, or at least you want to die. So 48 hours in, I remember spending an enormous amount of time in the lobby doing paperwork, and because that's the first thing you want to do when you're sick. 12 hours in, they brought me up to the floor and they put this medication under my tongue. And I remember one of the residents there telling me that you'll feel fine in 20 minutes. And I remember thinking, there's nothing on this earth that's going to take away all this sickness. I mean, you literally feel like you need a multitude of different medications because there's so many different body systems that are just shutting down and not working. But sure enough, in 20 minutes, I remember standing in the kitchen making a sandwich because I was now hungry. I couldn't understand it. I never asked her what it was, never asked her the strength, the milligram, the brand, didn't care. I just knew it worked. I just felt normal again, obviously, which was a godsend. 6 days on the medication, and then they send you home with a 1 week supply, and they tell you at the end of 1 week, you'll be fine. Everything will be fine. Well, I remember taking my last tablet, and then I remember, 12 hours later, I wasn't fine. What's going on? The withdrawals are still there. Why am I still sick? Why am I getting this sick again? So obviously we know now that short tapering on buprenorphine is ineffective. New science has come out that's shown, short tapering is just not effective. Fast forward a couple years, I was in law enforcement, got my undergrad in criminal justice. I was able to get my life back because I was able to actually find a doctor back then that would prescribe the Suboxone. Back then, the only brand was Suboxone, and it was, it started out as a tablet, then it became the film. everybody was given 3 a day because they didn't know a lot of science about the medication. All they knew was, here's a great medication that works for opiate use disorder. We give patients 24 milligrams a day and we're all good. I was able to get my life back. So, for all intents and purposes, it was all good. And then as working in law enforcement, I injured myself and had a friend of mine ask me about counseling. I'd never done it before. She owned a Christian counseling firm, and I said, you know what? I want to give this a shot. I really want to give back to people, and I want to explore addiction and give back. So I later, educated myself on addiction, and I got placed into a MAT clinic, Suboxone clinic, or sub clinic is what they call them on the streets, sub clinic. And I just loved it. And I took that and just ran with it. I received 22 credit hours from Harvard Medical School strictly based on opiate use disorder. Obviously, I'm not a doctor, but since we were in opiate crisis, they offered free courses and I took them. So I just educated myself on MAT, medication, the strength, the bioavailability, how it works. And it just amazed me how the brain works with opiate addiction. And I do want to talk a little bit about one of the best studies that I actually found on the internet, and it's a Dr. Corey Waller. It's an excerpt from 2015 presentation that he gave. He is the medical director of integrative medicine at Spectrum Health Group in Michigan. I believe he's still on the board of ASAM as well, but very world-renowned addictionologist and heavily into the neurobiology of addicted patients, in particular opiate addiction. And I want to help dispel the stigma of medication-assisted treatment, how it's not trading one for the other, how, we're not out there robbing grandma to get a Suboxone or money for a Suboxone, how this is very much a medical disease. And like all medical diseases, should be treated as such, and how the human being should be treated as they have a medical disease. I remember one time going to the emergency room because I felt like I was sick, and I was on Suboxone at the time. And this story can be told 100 times over because every one of my patients has felt this. I'm on Suboxone, and the nurse can't get an IV in me, and all I remember her is asking me how many years I shot dope. And I just remember looking at her with just such astonishment, like, how dare you? How dare you just label me as someone who is injecting dope simply because I'm prescribed Suboxone? I never stuck a needle in my arm, ever. But just because I was on this medication, she assumed I shot dope. Mortified doesn't even cover it. How many times that I'm now working in the addiction space for Southwestern Recovery, and how many times my patients will tell me their pharmacist, the negative connotation, the way they get treated, just simply because they're prescribed a medication. I don't see a pharmacist doing that to someone that's getting their insulin. I don't see a pharmacist doing that to someone that's getting any type of medicine, but they do it with patients who are on buprenorphine. So back to the study, Dr. Waller talks about, he was one of the people that actually did an MRI scan of the brain. And he talks about depriving a subject, a human being, of water for 3 days and simply placing water on the subject's lips. And the size of the dopamine release is the size of a baseball. And then he takes it and he does it with food. He deprives somebody of food for 3 days, puts a cheeseburger on their lips, and you can see the dopamine release in the brain the size of a basketball. And then he takes someone who went through an abstinence-based program, who was off of all opiates for 1 year, 12 months, and he simply starts a discussion about opiates. And you can see the size of the dopamine release is the size of a baseball field, which is so indicative of how crushing these cravings are. And you're talking 12 months after this person went through abstinence-based treatment. It doesn't say whether they did any other types of treatment, but it does say they've been clean for 12 months. But their brain is still craving that drug based off of a conversation. So imagine if it went further than a conversation and they actually were introduced to the drug and they saw the drug, in front of them. Pretty hard to, turn that down when, this craving is stronger than food or water. He talks about, your survival. Dopamine is your survival chemical. Dopamine is a chemical behind our drive and our a drive to live and survive. Rewards us with feelings of pleasure and satisfaction, and it also rewards us feelings of desperation and illness when we're not doing the right things. What a lot of people don't know is our limbic system is fine-tuned to regulate itself between 40 ng over ml and 100. So 40 is a bad day. Now this is all prior to addiction. 40 is a bad day. 100 is a good day. So, you lost a family member, you're at a bad day, you're only producing 40 nanograms. You have a great day, maybe it's your wedding day or something, you're at 100. But throughout the course of your life, you're going to be stable somewhere in between 40 and 100. From the very first hit of that opiate in someone who has the gene of addiction, our levels are driven up to 1,000. You're talking 10 times the best day you ever had. That's that feeling you get. And that's that feeling you chase and you chase and you chase for months until you no longer get that feeling. Another misconception is, in society, people think that opiate addicts are out there still getting high after 6 months of being on opiates. We ain't getting high. We stopped getting high 4 months ago. We're just trying to stay well. We're just trying to ward off the sickness. So with we have this chemical imbalance now that is literally going against us. So no matter what program we do, if it's abstinence-based, even when we're finished, and no matter what our will and drive is, we still have this chemical imbalance in our brain. So what buprenorphine actually does is, buprenorphine stabilizes that. It actually brings our dopamine levels back up to between a 50 and a 60. So now we feel normal again. 90% of my patients will say, I feel normal, myself included. That was the first feeling I could describe was normal. It wasn't high. It wasn't, I can run a marathon and do everything else. It was simple normalcy again. And that was that brain chemical going back to its normal level again. And throughout the course of time, it will stabilize that region of the brain, keep it normal. And Dr. Waller talks about the fact that it takes 18 to 24 months to stabilize that area of the brain again. So it is recommended to stay on 18 to 24 months. But most importantly, I want to dispel the stigma that somebody is out there using this medication to get high. Don't get me wrong. You can misuse any medication out there. You can misuse alcohol. You can misuse tobacco. So why not? Of course you can misuse buprenorphine, i.e. Suboxone. But, the patients that aren't misusing it and using it as a medication, it is a very formidable way to, heal their brain, help them get the treatment that they need. And all it really does is it heals the brain enough so that they are not in any kind of physical distress, so that they can come to counseling and actually talk about their life and actually work through their behavioral problems. So it's a combination of having both that is effective recovery. I don't encourage just buprenorphine alone. My personal story was I did do just buprenorphine for the first 2 years, and then I was introduced to the 12 steps. And I can tell you that it was a mixture of both that saved my life. Not just the medication, not just the 12 steps, but a combination of both. And in closing, Dr. Waller went on to say, people are 14 times more likely to die if they don't use medication-assisted treatment and only go for abstinence-based treatment. And another concept that he puts in here, that I really liked, he said, let's get to that. Excuse me. It said it brings it back to normal, and since medication is long-acting, it brings people out of the cycle of withdrawal and craving. If our goal is to punish people and make them feel terrible, then we would require abstinence-based treatment, co-sign them to a life of 10 to 20 nanograms of dopamine, and judge them for not being able to get their lives together. If we follow the science, data, and math behind opioid use disorder, we'll use these treatments that are proven to work, which are evidence-based treatments. Going back to that, abstinence-based treatment, your body's chemical, your dopamine, can only survive up to a 20. So now you're regulating between a 10 and 20. Prior to addiction, you were at a 40 at least. Now you're at a 20. You're miserable. So another reason why medications are effective. So in closing, that's kind of all my story in a nutshell. Medication-assisted treatment. The next time you look at somebody and judge them, and or if they're in a 12-step meeting and you look at that person that they're using a crutch, Well, remember, that crutch is healing their brain, from damage that was done to no fault of their own in most cases. This damage, wasn't done because they just decided to do damage to themselves. The brain damage was done due to the drugs. So now it's time to, release that stigma, and let people choose their own way to recovery. Thank you.